Hi, and welcome to the show where we share the stories of the many who intersect with our healthcare system but are rarely heard from. My name is Kevin Poe, founder and editor of Kevin MD. Today on the show, we have Simran Malhotra. She's a palliative care physician, and she wrote the Kevin MD article, The Many Firsts of Coronavirus. Simran, welcome to the show.
Thanks so much for having me.
So we'll get into your article in a bit, but first off, tell us your story and your journey to where you are today.
Yeah, so I was born and raised outside Toronto, Canada. After med school, I moved to Maryland to pursue my internal medicine residency. During residency, I met my now husband. We got married. And after that, I went to Hopkins to do a one-year fellowship in hospice and palliative care, finished that in 2016. And then over the last 4 years, we had 2 kids, and I've been working as an inpatient palliative care consultant. So I've basically been part of an interdisciplinary team that sees patients with serious illness. And so my everyday, I help patients make difficult medical decisions, help them with difficult symptoms, and just kind of address their overall goals of care and priorities in life. But one of the things is over the last few years, as I was caring for these seriously ill patients, I started to feel that despite our aggressive approach with pharmaceuticals and interventions, patients still continue to suffer with suboptimal quality of life. And so because of that, my own personal strong family history of cancer and my own genetic predisposition to cancer as a BRCA1 carrier, I became really interested in lifestyle medicine and kind of how using the approaches such as food, exercise, stress management, how we can use those approaches to treat chronic or reverse treat and prevent chronic illness. And so my interests have kind of shifted a little bit, and it's kind of interesting because I mostly deal with end of life care. But right now I'm working on completing my certification in culinary medicine, culinary coaching specifically to empower patients to cook at home. And then I'll be taking my lifestyle medicine boards in November. So eventually I hope to merge my passion for palliative care, culinary medicine, lifestyle medicine to truly provide more of a comprehensive approach to patients with serious illness to improve their quality of life and maybe even provide some longevity.
Wonderful. And how has the pandemic affected you and your practice?
Interestingly, and this is kind of what I wrote about in my article, which we'll get to in a bit, but it's been interesting how most of my job, the heart of my job was always sitting face to face with patients and families, empathizing, listening, helping them make incredibly difficult decisions. So much of it was face to face. And now with kind of most hospitals having a zero visitor policy and mine included, I transitioned more to a telehealth model, and having end of life care discussions via video has been probably one of the most humbling experiences of my life. And I don't even know if I have words to describe what I've seen over the last 4 months, but what I wrote about in my article about patients dying alone in ICUs is exactly what I saw. The existential distress in families as someone sitting across a screen to provide comfort. It's so difficult, but it's very humbling. And so I think the other thing I saw in my practice is that, our colleagues would always call on us for these difficult decisions, but just like there was a shortage of ICU beds and ventilators, there was a shortage of palliative care clinicians. And so watching some of these residents and seasoned physicians struggling with these incredibly difficult conversations, it was really hard.
Now, what have you learned over the last few months? Because clinicians across the country are going through similar stories like what you're describing in terms of zero visitor policies and having difficult conversations remotely. Can you share any advice and tips with these other doctors?
I think the biggest thing is just to remember to be human, and to remember to empathize. We all know what it feels like to have family and to be away from them when they're sick. We can only imagine what that feels like. So I think my biggest tip would probably be just to be human, to listen, and to let them speak their fear, let them speak their anxiety, and sometimes just that in itself can empower them and give them comfort.
Now, let's get to your Kevin MD article, The Many Firsts of Coronavirus. So you talked about this briefly earlier, but can you walk my audience through that article and the reasons why you decided to write it?
Actually, funny enough, the article came to life purely as a journaling exercise because of my own COVID-related fear and anxiety around the uncertainties of the disease and the future. So I wrote it at the beginning of March as the pandemic was starting to emerge here. And so I wrote it from my very different views, some of the things I wrote about, I actually experienced over the last 4 months, and some of the things I didn't, thank goodness, like the lack of PPE. I didn't have to experience that. So we were grateful for that. But, personally, my husband's a critical care physician, so I knew that he was going to be in the trenches when it came to COVID. And the crazier part of all of this is we spent much of January and February planning for and being anxious about my preventative surgeries that I had mentioned earlier. I'm a BRCA1 carrier, so I had a preventative mastectomy and hysterectomy planned for June. And so all of a sudden that fell through. And so that's where this article, I just started writing. And so we have, like I mentioned, 2 kids under 3.5, all our families in Canada. We all of a sudden started planning for the worst case scenario, got our estate planning, our guardianship papers in order, and just kind of, to be honest, for the first time as doctors, feared for our own lives going to work. So that's kind of where the article came from. It was just purely me writing out what I was worried about.
Sure. And you wrote this article back at the end of March, and we are now speaking of last week of July. So you mentioned that PPE situation is a little bit better now, but what else has changed now compared to when you wrote that article back at the end of March?
To be honest, from a general, just worldwide perspective, outside of medicine, I think it's just amazing how this pandemic has forced us all in medicine and outside of medicine to just put our lives on hold, to be more mindful in the little things in life. I've seen people spend more time with their families, spend time outside, cooking at home. And then for the first time ever, we've seen the earth healing, which to me is just incredible. People in India are saying they see the Himalayas from places they've never seen it before. Air pollution in China is getting better, just things like that. And I think with all the other events that have taken place over the last 4 months, I think it's shifted just on a human population level. It's shifted our thinking. People want to be better. They want to do better. They're vocalizing their feelings. And so I just think we're moving towards a better future for us, for our children. So we'll see what happens.
Now, is there anything that you know now that you wish you knew back before the pandemic started?
I mean, I wish I knew my surgeries were going to be canceled, right? Because then I wouldn't have spent 2 months stressing out and being anxious. So I guess the biggest thing COVID's taught me is, you control what you can. Yeah. And this is what I tell my patients. My signature line is, we hope for the best and we plan for the worst. And in between that, you just got to live life, right? And so COVID has shown us that you don't know how your life is going to change tomorrow. So we just got to live for today.
We're talking to Simran Malhotra. She's a palliative care physician, and she wrote the Kevin MD article, The Many Firsts of Coronavirus. Now, I'm a primary care internal medicine physician, and can you share some tips with other primary care doctors in terms of how to approach palliative care, end-of-life issues, advanced directives in a primary care setting?
I think I wouldn't be a palliative care doctor if I didn't bring up advanced care planning and advanced directives. So I think COVID has just brought to light the dire need for advanced directives. And I think currently only about 1/3 of Americans have them. So I think whether you're young, you're healthy, you're chronically ill, and now even if you're a healthcare worker, I think you should have an advanced directive. And from my personal experience, discussing end of life wishes when someone's acutely ill in the hospital is extremely difficult. There's just so much emotion and anxiety that clouds your ability to think clearly and make an informed decision. So the best place to do it is at home with your primary care doctor when you're able to have a conversation about it and think about it. So that, I think, talking about advanced directives is probably one big thing. And then I think, just like I said earlier, just we all got to just remember to be human. We're all going through an incredibly difficult time. Everyone has something or the other that makes their situation unique. So I think we just need to listen, be compassionate, empathize, and just get through this together.
And my final question, can you share a take-home message that you want to share with the Kevin MD audience?
I mean, I think a little bit outside of palliative care and just kind of healthcare in general, I think the pandemic will eventually end, but I think there are some much larger epidemics in this country that have been pre-existing and now emerging and need major attention. But the two things that came to light from this pandemic, in my mind, number one, and I've seen this personally with COVID over the last 4 months, is that African Americans and other minorities have clearly been disproportionately affected. And then number two, people with chronic illness, obesity, diabetes, heart disease, have been more likely to get severe COVID-related morbidity and mortality. And a lot of these people are African Americans and minorities. And so I think we need to work towards kind of correcting these health disparities, these inequities, and again, use the power of lifestyle medicine as part of the solution in prevention, reversal, and treatment of these epidemics of chronic illness. So if we ever face a pandemic in the future, maybe this country won't see such devastating morbidity and mortality like we have. So I think that would be the biggest thing.
Simran, thank you so much for sharing your insight and time, and thank you for being on the show.
Thanks so much.